Hey everybody, welcome to Clear Talk for Clarity Hearing. I'm your host, audiologist and owner of Clarity Hearing, Dr. Scott Marquardt. Today we're going to be talking about a specific kind of balance issue or dizziness called BPPV, and I'm joined today with our expert on this topic, audiologist Dr. Dominique Olivarez. Welcome.
Thank you.
So my first question, what the heck is BPPV? What's that stand for?
Benign paroxysmal positional vertigo.
Well, easy for you to say. Good. So what causes BPPV?
Well, it comes from the little crystals that belong in our inner ear in a jello-like substance. They can break loose. When they break loose, the result would be that putting your head in a certain position will result in room spinning. It seems like the room is spinning, but it's really not.
So little crystals, so like you have rocks loose in your head?
They're really calcium carbonate crystals. And so how do they get loose? It depends. Sometimes someone will have a head injury, and so the crystals will come loose. We'll see it when the head has been tilted back for an extended period of time, such as like on a flight, a 30-hour flight, or a surgery. If someone has had a separate inner ear disorder, the crystals can come loose as a secondary event.
Interesting. So how common is this?
It's more common in adults over 50, and then especially adults over 70. 50% of individuals over 70 will have BPPV.
At one point in their lives they'll have?
Yeah.
That's a lot. So what are the most common symptoms?
Typically, someone will report the room spinning vertigo, and it'll be like if they were looking up at the ceiling, turning over in bed, or bending over. And so it's just a certain position, a certain head position that'll trigger their room spinning sensation.
Does the spinning last for a certain amount of time typically?
It lasts usually for a few seconds up to a minute.
Okay. And then are there tests to determine if this is what I have? How do you know?
Yeah, so the test is really simple. What I would do is have the patient sit on a table. They will have their legs in front of them. I'll ask them to turn their head to one side, lay straight back, keeping their eyes open. I'll be supporting their head and looking for abnormal eye movements called nystagmus.
And so what happens if this is something that I do have? Is there a treatment for it? Can it be fixed?
Yes, so it involves more positions. So we'd put the head in different positions to slide the little crystals back into place where they belong.
How effective is that?
It's very effective. Typically after the first visit, patients will feel much better. They'll go on. If they have it again, they'd come back for a second visit. Typically, it doesn't take more than 2 visits.
Well, that's exciting because you can actually stop the dizziness from happening.
Yes, so when a patient comes into my clinic feeling dizzy and we find that it's BPPV, I'm happy because I'm confident I can treat it.
Great. So if I think that I have BPPV, what should I do? What's my first step? What's my next step?
We'd need to see you for testing just to confirm. So the best thing to do if you're in the Houston area is call 936-273-4437 and schedule an appointment.
Great. Thank you.
Yeah.
This is great information. Appreciate it.
Yeah, you're welcome.